Throughout my high school years, I worked in a hospital setting doing a variety of things. My father was an administrative engineer at Southwood Hospital, and he was talking to the staff in radiation oncology one day and thought it was something that I'd be interested in. So they made arrangements for me to shadow in the department for a few days, and I had the most amazing experience with the patients and the staff. It just really clicked. I applied to Labouré College that year and graduated in 1993.
He came as a radiation therapy student, and he's just progressed through the ranks of development here. He became a dosimetrist, then he became the chief therapist. He left for a time being, went back to become a paramedic and a firefighter and a dad. So he's kind of the village people all in one. He'll be the first one here in the morning and the last one to leave at night.
He is very bright, very compassionate. It's important for a radiation therapist to be compassionate because they are dealing with a patient at the worst time of their life. They've had a diagnosis of cancer. To be able to have empathy and understanding and get them through their treatments, it's really important.
When I met Ashlyn in 2006, she was only 2 years old, close to the same age as my children at the time. She had a medulloblastoma, the posterior fossa of the brain. She was just an amazing young lady, and her parents were very engaged from the beginning.
I was nervous, but then I wasn't at 2 weeks later.
Hey, how are you, sweetheart? Nice to see you.
He has a big heart. He always let me wear my pajamas, so I was always comfortable. It's kind of cute. Say that.
Usually patients at that age need anesthesia every day. Although it's necessary, it's not ideal to put a patient under every day for that amount of time. So we spent the beginning course of treatment working with Ashlyn and her parents to do the treatments without the anesthesia. One day we decided, well, it was time and we'd give it a shot, so we had anesthesia stay on standby, and we brought Ashlyn into the room. Lined her up for her treatment. She needs to wear a mask that's basically bolted to the table. So having a 2-year-old, for one, it doesn't sit still, and two, to actually bolt them to the table and to be alone in a room was amazing. She did it without any problems at all. It was the most amazing thing. It was such a huge victory for all of us.
If you're a parent and you see your 2.5-year-old child doing something that you don't think you could do yourself, it's amazing. We've had some ups and downs in the past 10 years. Really great times and really hard times. Just being able to walk in and give a big hug and a snack together, it makes coming to this kind of place for what we have to do not so hard.
To see Ashlyn grow has been amazing. I get a page to the front desk every so often, and to see Ashlyn there waiting for me and to greet me with the biggest hug makes all the difference in the world.
You could look at him and wonder if it was his child. Given what he does every day and what he does it for, and just seeing how he loves my daughter, it just warms my heart as a parent. We do some pretty hard things, and to see some really positive greatness come from it is, I don't know, I can't even think of a word.
Magnificent?
Magnificent, perfect, yes, magnificent.